Hello parents, I am Dr.Deepthi. I am a developmental pediatrician and a special educator. We have Happy Kids Center. It is a special needs center catering to all kinds of neurobehavioral problems like autism, ADHD, speech delays, dyslexias, ID, etc. We are recently starting a branch in Hyderabad too. On this Mother's Day special, my interest is how can I help in probably improving the mental health status of parents with these special need kids. So this small little video I hope will be useful to you. So to begin with, when I say a parent should be happy and strong enough, and only then the child will see improvements. But most parents say, but how can that be? If a child is in this state with so many behavior problems and recently diagnosed autism and all, how do you expect us to be happy? We will be happy, but provided he improves. But what I'm saying is, he will improve only provided you are happy. This has to be taken in a right sense, especially by the mothers, because most of the time fathers are okay, they are like accepting and they're like, yeah, we understand, let's try to do our best. But mothers going to a phase of depression, anxiety, sleeplessness, frustration, and they lock themselves down and they're not going out, and completely their lifestyle has changed entirely, and they have become from such happy souls to a very, like lifeless kind of people. So these are the 7 tips which I would like to give, so probably you can be more happy and strong. So you might say, saying such tips is very easy, doctor. If you are in this state, only then people will understand. But many of you might not be aware, but I am I am a mother of a special kid who is 14 years now. So I have been through this entire journey. That's why probably I can see these kind of sensitive issues through the eye of the parent also. So I'm not here to give any professional advice, but this is as a fellow parent that I'm telling you this. So the 7 tips are, first and foremost is avoid guilt. This is very, very important. Most of the parents, the moment child is diagnosed with any neurobehavioral problem for that matter, not only autism, anything, whether it is intellectual disability, global delay or anything, they start blaming themselves. Maybe I did something wrong, maybe my pregnancy was wrong, maybe I took too much stress in pregnancy, or maybe I had eaten something, and so on and so forth, or maybe we didn't bring him up the right way. Even in virtual autism, where we ourselves say that the environment was a driving factor for the poor behavior of the child, still the guilt will be there, but we have to come out of the guilt very soon. But if it is going on for months and years, then neither you can do anything fruitful to your child, and nor you will come out of this depression. So this is a will of God, you have to take it, whatever happened, and from here what you can do, you have to start doing. So first, come out of this guilt phase. If anybody else is trying to prove you guilty, whether it's your family, close family or friends, try to avoid them and don't take it too personally. Just listen, or even don't try to listen, just ignore it, because you know from your heart that this is not something you could have avoided. The second is, when I say build up a good connection with your child, only then any of these therapies or interventions are going to work. What are the foundations that this connection should be built on? So like any building, we will have 4 basic pillars, and these 4 pillars, if they are stress, anxiety, frustration and depression, which are occurring in most of the parents, the foundation itself is very shaky. Although you approach a child, you cannot really connect to him. So you have to replace these with the other 4 things, which is hope. Very, very important. You have to be hopeful. Okay, this is a problem, but there can be a solution. If not a cure, something to mitigate the problem. Second is faith. Whether you are a believer of God or something else, or you're an atheist or anything for that matter, you should believe that some faith will guide you in the right direction. It could come in the form of a therapist, it could come in the form of a friend, it could come in the form of some resource or some professional, but some faith you have to have that you will be going in a correct path. And third, unconditional love. When I say this, everyone says like, of course we do love our kids. Yes, we do, but we think if he is better. So there is a quote that you love the child you have, not the one you thought you will have. Okay, so unconditional love despite their challenges will go a long way, and a commitment. This cannot be done overnight. We know magical cures can't happen in autism. So it is a long process, but you have to be committed to it. It is not like 1 month you have done everything possible and then you have again gone back into your shell. No, it takes a commitment, and it takes years together sometimes. So these are the 4 foundations you have to build for having a good connection with your child. And third is, this is very, very important, especially for the mothers. I would like to say this: have a life of your own. The moment a child is diagnosed like this, a very happy, bubbly parent or a lady also, they go off into a shell. They retract. They feel that, oh, maybe if I'm enjoying like this, that's why this child is like this. Or if I enjoy like this, then what will others think of me? Or sometimes it is not even others, it is only yourself, this guilt that is killing you, that you want to spend the entire day with the child, which is good. I am not saying you should not spend, but not to the extent that you go into a burnout. So you take time for yourself, have a life of your own. If you are very passionate about your career, do it small part-time kind of thing. If you're not very particular about the career, leave the career, but you can take some hobby or anything, your own leisure time, 1 or 2 hours in a day, keep it for yourself. Have a close circle, a good people like with whom you can vent out all your emotions and everything. They probably may not give you any solution in this, but they'll just have a listening ear and a shoulder on which you can lean on. Like a good friend will make a huge amount of difference. So don't lose connection with your friends or colleagues who are very supportive. And you spend time with your spouse also. Don't feel guilty about it, that you have to take the child along everywhere. Wherever possible, you try to go and have some private time. And fourth thing is, you should have a very close support system also. By what support system I mean is, whether it is in-laws or parents, wherever possible, wherever they can help, please call them and tell that this is your problem, this is the help you need, and don't feel like guilty about it, like how can I ask their support, they are already old. It is fine, they will still help in their best possible way. If this is not possible, you invest in a full-time maid. This is my sincere suggestion to most of the parents, or at least a maid who stays with you for 10 to 12 hours in a day, which will be of immense help, because you are only cooking, you are only cleaning, you are only doing the whole household work and taking him to therapies, because obviously husband has to go to work, and after coming again you are being said that 2 hours you should do activities at home. Where is it possible? Humanly this is not possible. So you invest in a good maid. If you have 2 kids, how do you engage 2 kids? So the maid is at least engaging the other kid, helping in the homework or taking him out and all. You can spend the time with this child. So definitely have a very good support system in place. Don't think you will be doing everything by yourself. And fifth one is, do not Google too much. Maybe internet has helped you in coming to early diagnosis of maybe this is autism or virtual autism or ADHD or whatever, but if you constantly keep Googling, your mind will be totally cluttered. Because see, Google is like this. If I type a swelling on the forearm, it will start with small lipoma to it will go to some skin cancer, and automatically human brain is that we will think about the cancer first. We will leave the commonest one and the rarest possibility. We'll think, what if this is cancer? Even if the professional says no, this is simple fat tissue, you are like, but what if it is cancer? How can you be so sure it is not cancer? And all these things, and you'll be seeing the little bit of growth in that. By 0.5 centimeter you get anxiety and palpitation. So this is very common. So please don't do too much of research on the internet. Go to some professional who you feel or you have faith, or you feel he is very professional, explaining you in detail. And also you can go to some sites for information, because I read a lot of information on autism and all through net. I can say 70% of what I have learned over this 15 years of total journey was through net. But having said that, I am a medical professional, so I know whom to believe and whom not to believe. But for a normal person, you don't know which site is authentic. So there are sites like Autism Speaks, Autism Truths, etc. There you can go and search for information, or some center related sites, good centers are there, from them you can see the sites. But don't see every site that you're that there is access on net and get panicked, especially if these kind of reports, like somewhere somebody said something, somewhere somebody did something and it worked. That is not how we are going to go about. We have to have some evidence based conclusions before we jump into any therapies or any new interventions. Sixth is, this is again very important, that appreciation of improvements. What I say is, when they come to us, when we say it is going to be a slow process and all, most of the parents are like, yes doctor, we understand, we are okay for it, even if it takes 4 to 5 years, we are going to work with him, etc. But when it comes to reality, the child is actually improving. It is improving quite fast as we expected or we didn't expect. Still, the parent will immediately raise the bar. Oh, he's giving eye contact and joint attention, doctor, but he's not saying anything. Then once he starts saying something, they're like, okay, but they are not so meaningful words, they are like non-functional. Once he starts saying some functional words, but they are not phrases, his peers or his classmates are already talking in sentences and he's not even expressing anything. And once he starts expressing fully, then we are like, to my questions he's not answering. So this raising the bar too quickly only leads to more and more disappointment. You are not even enjoying the improvements the little one is showing you. So here, my sincere suggestion to all parents is, if you really understand the definition of stress, stress is nothing but the gap between your expectation and your reality. So if you keep your expectations and reality almost at the same level, then almost there is no stress, whatever the situation may be, or maybe the stress is very minimal. But your expectations and the reality don't match at all, then you'll always be in this constant cycle of stress. So please try to avoid that. Enjoy the improvements, appreciate that little fellow, and give him time and be patient. And last but not the least, and probably the most important, is having a sense of gratitude. By what I mean by gratitude is, I being a medical professional in this pediatrics, my journey started way back in 2007 in PGI Chandigarh. So most of you must be knowing it's a huge hospital for pediatric patients, and we had entire, not a small room, entire floor of cancer patients, especially kids. So they had all kinds of cancers, blood cancers and anything, you name it, and any cancer was there over there. And the mortality rate was so high. Every month we used to see so many kids unfortunately leaving. So when we stand in their shoes of those parents, their mindset was like, just if he comes out of this cancer, nothing else we need. So at least autism is not a life and death problem. Having said that, I do understand how challenging it is to manage these kids day in, day out, and we can't but think of how they will be tomorrow in this society when they grow up, and will they be self-sufficient, etc. But still, whatever it is, we are much more privileged than most of the other sectors of the society, in whom even if you diagnose autism and both the parents are like small laborers, etc., residing in a village, they don't even have these facilities which probably we are having access to. So let's have a sense of gratitude that things could have gone much worse, but luckily not so bad. It is still in our hands. The child is with us, he will be safe with us, and with all hope we can do the best for this child. So I hope some amount of inner strength or mental peace you would have gained with this, having seen these 7 tips. And I would like to know the inputs in the comment box. And all I can say is, on this Mother's Day special, happy moms make the most difference, and be one.